Good morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine and Principal, Pikidas Institute of Medical Sciences. Today I am discussing with you how to write a prescription. Prescription writing has been taught in pharmacology, and as you reach the clinics, usually the principles are forgotten. Since centuries, it is thought that those with bad handwriting become doctors. We have to change this. What is the problem with the bad handwriting of doctors? Bad handwriting of doctors is responsible for at least 7,000 deaths every year. This came in the National Medical Journal of India 2018. So this sort of handwriting only God can read, or some pharmacist. So the first and foremost thing, the handwriting should be legible. And there are discussions going on whether it is time to totally ban handwritten prescriptions. And government has taken this seriously and has advised that doctors should prescribe drugs in generic names. So that is one thing you should remember as an intern. Second is write in capital letters. The advantage of writing in capital letters is that it is very unlikely that errors or the errors can be minimized. In a BCOP like this, it may be difficult, but the principle should be kept in mind, as it is a legal document. Prescription is a medical document and it has got a legal value. The ICMR has recently come with a pattern for the prescription or the prescription pad. So this should contain the doctor's details, including the register number, then the patient details, including address, and weight of the patient should be recorded, especially in pediatric cases. Then the name of the drug medicine should be written in capital letter. That is one point to be, which we have already mentioned. It should be written capital letter and it should be the generic name, not the brand name. If you write the brand name, generic name should be mentioned. The strength of drug, the dosage of drug, instructions how to use it, how long you should take it, and what is the total quantity. All these should be included, and this is the inscription. And at the time of dispensing, the date and the pharmacist details should also be mentioned by the pharmacist, and the doctor should sign. So this is, in summary, the format given by ICMR. Let us look into what are the common errors. The wrong or inappropriate drug, especially drugs that sound similar. For example, that endoxan. Endoxan is cyclophosphamide. A similar looking drug is imidoxin. It is an antiemetic. So fatal errors can occur if, because of the bad handwriting or illegible handwriting, the pharmacist interchanges the medicine. So this importance of writing in capital letter. While writing in capital letter, usually you will not make much mistakes. Poor illegible handwriting is a major reason which we have mentioned, approximately 7,000 deaths per year. Then failure to look into the drug interactions. So for example, tetracycline along with calcium. Similarly, different drugs can have interactions, so that should be kept in mind while writing the prescription. Two drugs from the same class is very common because the patients are seeing many doctors and the prescriptions are not shown to the next doctor. So what happens? Same analgesics may be repeated, or the same class, another analgesic may be given. Another example is patient may be taking dexamethasone and you will prescribe prednisolone. So this may lead on to overdosage. Then other omissions and commissions can occur, including wrong doses, wrong route of administration, calculation errors, which are very important, especially in pediatrics. Third is regarding infusions. not enough details of the diluent rate. For example, when you are giving potassium infusion, the details should be given through which vehicle, how much or how many drops should be administered. Another example is insulin infusion. All these are important. Then don't forget about the date in the prescription. Then a few more points. One is avoid trailing zeros. For example, 5 mg should not be written as 5.0. So this can very easily be mistaken as 50 mg. Then always use leading zeros. For example, when you are writing 0.8 ml, put a 0 before that, so that 0.8 ml will not be read as 8 ml. Then quantities less than 1 gram, and never write 0.1 gram. Write 100 milligram, not 0.1 milligram, 0.1 gram. But if it is more than 1 milligram and less than 1 gram, it should be written in milligrams as shown here. Hope this point is clear. Less than 1 milligram, write as micrograms or nanograms wherever is appropriate. Don't abbreviate the micro. You write as 100 microgram. For example, thyroxine, never write 0.1 milligram. You write as 100 micrograms. Hope this point is clear. Then signa, that is how the patient should take this. For example, if you are writing atenolol 100 milligram, write 100 milligram atenolol once daily. If some drugs has to be taken before food, for example, thyroxine, write 1 tablet or 100 or 150 micrograms on empty stomach. So clearly this should be spelled. Another example is amoxicillin 250 milligram. We can use the abbreviate as TDS, but always tell the patient what do you mean by this. Take it 3 times daily, or if it is written QID, take 4 times daily. Sign the document. It is very important, not only for prescription, but in all medical documents you should have your signature. So what is signature? Signature is your name written by yourself, always in the same way, to show that something has been written or agreed by you. So signature is actually your name written in running letters. That is the ideal way of writing signature, and after writing the signature, you should write your full name, preferably in capital letters. So signatures like this may be familiar with everybody. So this belongs to Mahatma Gandhi. Unless you are so famous, don't put the signature alone. Your name should be there. And if you go into the word meaning of signature, it came from Latin. Signare means to sign. A handwritten and often stylized version of someone's name or nickname. That also is called a signature. Ideally, it is name written in running letters. Now we go back to the format for prescription. This is from Goodman-Gilman. As you studied in pharmacology, there is a superscription, inscription and signature. So here you can see the details of the doctor is given, the details of the patient including address, the date is clearly, and the age and sex of the patient and the weight is written. Start with the symbol. Here it is written losartan 50 milligrams tab, dispense 30. So the strength of the tablet, the amount has to be dispensed, and then comes the signa, taken by mouth daily in the evening for blood pressure control. So the indication for the medicine and also how to take in the drug. And he has written refill, because medications like antidiabetics, antihypertensive can be refilled without doctor's prescription. So refill 6 times, so that the pharmacist can issue. And generic substitution, if it is okay, write down okay. But some drugs like antiepileptics, if you change the brand or change the company, the absorption and other things will be different. So you may write no substitution. Then clearly written the signature of the patient, not the patient, signature of the doctor, and with the date. So this is the ideal way of writing a prescription. So in short, we have discussed what are the components of a prescription, how to write a good prescription, and the most important thing, it should be legible. The identity of the person should be there, and remember, it is a medical legal document, so do it properly. Hope this was useful to you. We'll come with similar videos next week.